Welcome. This is going to be our first presentation for the Pre-Dental Study Club. My name is Ghazel. If you don't know me, I'm the founder of the Pre-Dental Association at York University and also the founder of the Pre-Dental Study Club. Now, we're going to go over what the study club is. It's a fairly new initiative that we've started, and I'm really excited for it to take off. So I'm going to go over what the study club is, what you're going to be getting out of it, and how it's going to run. So let's get started. Okay, so the study club, it's the first of its kind. I personally haven't heard anything of a pre-dental study club. I fortunately have been invited to dental study clubs, which is actual dentists gathering around together, and that's when they talk to each other about their expertise, stuff that they've learned, all different types of stuff regarding the field. So I kind of got inspired by that. I'm like, I think we should have a pre-dental study club because I haven't heard of one, and this is where you can be able to research whatever topic you like in the field of dentistry. So I'm going to go over a few kind of examples of what you can be studying, but essentially this club is going to be you guys picking a topic in the dental field besides dental admissions, and that's when you're going to do all your research and you're going to be presenting it like this. So the next question you might have is, well, what can I gain from this? So not only will you be gaining valuable research and presentation skills, but you're going to be, a part of an amazing initiative, and you're going to be getting a lot of volunteer hours. So again, the amount of hours that you're going to get minimum is 5 hours. So straight off the bat, when you present, you're getting 5 hours. So that's a pretty good deal. And so for presenting, you're going to get at least a minimum of 1 hour. So we're going to try to have you guys do an hour, but of course, you can't always do that. So if you can do at least 45, that's totally fine. But we're obviously going to give you guys an hour, and same with the attendees. So automatically, keep saying that a lot, you're going to get 6 hours of volunteering just by presenting and being a part of this. So it's a pretty good deal. Next, you're going to be thinking, well, what kind of topics can I research? So again, besides the dental admissions type of presentations, like that ones that we have in the pre-dental club, like how to get into American and Canadian schools, you can be doing stuff like forensic dentistry, public health type of correlations, for example, like Alzheimer's and oral health. How is that connected? Cancer and oral health, how is that kind of interconnected? Specific dental procedures, and kind of going in depth, because I know there's a lot of overview of procedures, but this is kind of going in depth, and you're doing your own research about it, so it'll be really interesting for you. You can talk about current dental topics and just any topic that you feel like it's interesting. For me personally, I love dental anatomy. I love learning about it. I'm learning a lot in the dental office I work at right now. And, forensic dentistry is also something I'm really interested in. So I'm a fan of true crime. So it's really interesting going to hearing these different cases that were solved through forensic dentistry, such as Ted Bundy. So if you want me to talk about that, I can definitely do so. Okay, so like I said before, you're going to get a minimum of 5 hours just by researching and, being a presenter. And again, if you have at least an hour or 45 minutes of a presentation, you're going to get 1 hour of that as well. Or you can have 2 hours. It's really up to you. The floor is yours. And also you can get hours for just attending. So again, whatever length that presentation is going to be, minimum hours, you're going to get at least 1 presentation just by attending. So you want to wait to the end of the presentation to get the Google form to fill that out, and that's how you can get the presentation hours. But we do encourage you to become a presenter because, again, it's a really great opportunity for you to gain some research skills. I know a lot of pre-dental students want to have research, but it's not in the dental field. So this is kind of sort of happening. So what you do is you research a certain topic, you make a presentation like what I'm doing now, and you present it. So I know we're not experts at everything, but it's good to kind of research, dive deep into that topic, kind of ask any questions, all of that. So I think it's a really good opportunity for you guys to be a part of this. And it helps you get over your shyness. I've done a lot of seminars and I love presenting, and that's just based off of the amount of times I've done it. So it's a really good opportunity for you. So please definitely be a presenter. It's going to be great. So we're going to get started with dental anatomy. So this is going to be kind of the framework of what we're going to talk about during the discussion. So the landmarks in the oral cavity, teeth in the oral cavity, the types of teeth, surfaces, the dentitions, baby teeth, adult teeth, you know, the occlusion, dental numbering system, and also talking about kind of like your gums as well. So I'm going to get started with that. If you have any questions, feel free to ask them in the YouTube chat. I am, again, not an expert. This is just research I've done on the internet and from my own kind of knowledge as well from being in the field for so long. So I hope you guys gain a lot of information and a lot of knowledge. So we're going to get started. I'm going to turn off my camera so you can be focused on the presentation and stuff. Okay. So we're going to start with the overview. So the oral cavity and its surroundings and its supporting structures are not only affect our digestive processes, but they also affect our speech and appearance. So in order to identify problems in the oral cavity, a dentist, a hygienist, they must first recognize a normal anatomy as well as the normal appearance of the surrounding areas. So when you're a pre-dental student, it's really beneficial for you guys to learn about dental anatomy. When I was first starting my shadowing experience, I really was confused with the vocabulary and the terminology. So this is going to kind of help you gain a better understanding of what's going on, the type of terminology, and hopefully it can give you some insight as well. So in addition to this, it's really essential for like a dental professional to be able to evaluate the health of our teeth, as well as the surrounding tissues and the periodontium. So even though the dentist is responsible for all diagnosis, like all dental professionals, hygienists, assistants, oral surgeons, everybody should basically be able to recognize deviations from the normal in order to determine the need for further investigation by the dentist. So we're going to go over some vocabulary. The ones that I bolded here are ones that you're going to hear a lot during this presentation, such as deciduous teeth. So this is going to be kind of your first set of teeth, your baby teeth, also known as primary teeth. Dentin is the tissue of the tooth between the pulp and the enamel and the cementum. So the cementum is the tissue covering the root of the tooth. And we're going to have enamel, so the tissue covering the crown of the tooth, which is also the hardest substance in the body. We have gingiva, which is the tissue that surrounds the teeth, also known as your gums. And then we have occlusion, which is basically a term that's used to define how the upper and lower teeth meet when you're closing your jaw. So we're going to go over this as well, and it's really fascinating, and you're going to kind of be learning more about the different types of occlusion. We have periodontium, which is the surrounding and supporting structures of the teeth. The pulp, which is the innermost part of the tooth that contains the blood vessels and the nerves. So this is what kind of gets extracted when we do a root canal. We have the quadrant. So this is the mouth that's divided into 4 quadrants, 2 in the maxillary and 2 in the mandibular. We have the mandibular, which is your lower jaw, and your maxillary, which is the upper jaw. So these are 2 terms that you should know by the end of this presentation. Next, we're going to be talking about the surfaces. Now, this slide is going to be your savior when you're going to be shadowing. I know when I've done our shadowing sessions, this is like the #1 thing I tell students, like you have to know what we're talking about and the type of surfaces, because you're going to hear a doctor, a dentist say MOD, you know, OB, stuff like that, but you're going to be like, what are those letters, like, what are they for? So it is basically the different types of surfaces here. So we have buccal, apical, distal, dorsal, incisal, labial, lateral, lingual, mesial, occlusal, posterior, and ventral. The surfaces on teeth are usually, from my experience, are buccal, which is facing the cheeks. We have distal, which is surface away from the midline on the face. We have dorsal, which is the top surface, also known as occlusal, basically. We have incisal, and that's the cutting edge of the anterior teeth. So your front teeth, that's what we use as the terminology. We have labial, which is the facial side, lateral, which is the sides. We have lingual, towards the tongue. Mesial, which is facing towards your midline. So you're going to hear that a lot, MOB, all that, DOB. So mesial is kind of towards the midline, distal is toward, like, away from it. We have occlusal, which is again the chewing surface of your teeth, of your back teeth. Posterior, which is toward the back of the mouth, so behind, and ventral, which is toward the bottom surface. So the underside of the tongue is also known as the ventral surface. So these are the landmarks in the oral cavity. So we're going to start off with here. So we have the pylars of Fossis. So this is the passageway from the oral cavity to the pharynx. So I know you guys have probably taken some anatomy course, but you definitely know your pharynx from physiology courses if you haven't taken that. We have our pharynx here, which is the raised folds of tissue that extend from the alveolar and the buccal and labial mucosa. So it's right over here. And we have the pilar fosses here. Then we have the gingiva. So the gingiva here is the mucosal tissue surrounding portions of the maxillary and the mandibular teeth. So it's basically your gums and the bone. And yeah, it's covering the bone as well here. You have the hard palate, which is up here, so the top, the roof of your mouth. And you also have the soft palate. So this is all the kind of soft tissue that you have at the back of your mouth. We have the incisive, where'd it go? The incisive papilla, and this is a tissue projection that covers the incisive foramen, which is right over here on the interior of the hard palate. So like I said here, the hard palate is at the top of your mouth essentially. And this is basically behind the maxillary central incisors. So right above here, you're going to see that. We have the maxillary tuberosity, and this is kind of a bulge of bone posterior to the most posterior maxillary molar. So you can see that right here. If you kind of put your tongue at the back of your mouth where your last molar, or your second molar should be, you'll feel it. We have the mucosa, which is the mucous membrane lines the oral cavity. It can be highly keratinized, such as what covers the hard palate over here, or lightly keratinized. So such as what covers the floor of the mouth and the alveolar processes. Or it can be thinly keratinized. So this covers basically the cheeks, the inner surfaces of the lips. Then we have the palatine glands here. So these are kind of firm ridges of tissue on the hard palate. So you'll see that right there. And then we have the parotid papilla. Forgive me for pronouncing some stuff wrong. But this is a slight fold of tissue that covers the opening to the parotid gland on the buccal mucosa. You see that right there, which is adjacent to the maxillary first molars. So right over here should be your first molars, and it's adjacent to it. Okay, you have your tonsils here as well. So I'm not sure if some of you guys have your tonsils. I sure still have my tonsils, but that's placed right over here. And then we have a uvula. So this is the non-bony muscular projection that hangs from the midline at the posterior of the soft palate. So you'll see that right there. Okay. So now we have the tongue. So we're going to start with the apex of the tongue, which is right here. And this is the tip of the tongue, essentially. Then we have this circumvallate papilla. And these are two V-shaped rows of larger, flat, cup-shaped papillae on the posterior dorsum of the tongue. So these are what contains the taste buds, which is really interesting. So if you stick out your tongue, you're going to see this definitely in the mirror. You have your dorsal surface of the tongue, which is the top surface here. You have the filiform papilla, which is fine, small cone-shaped papilla, which covers most of the dorsum of the tongue. So they're really responsible for giving the tongue its texture, and they're also responsible for the sensation of touch. Then you have the foliate papilla, and these are large red leaf-like type. They're located on the posterior lateral surfaces of the tongue, so right over here. And they're containing some taste buds as well. Then we have the fungi form here, papilla, and this is deep red in color. So this is towards the apex of the tongue, so kind of on the top, you'll see it there. And these are distributed over the dorsum of the tongue. So each one of these mushroom-shaped papillae is kind of containing the taste buds. So you'll see there's a lot that goes into the tongue. Then we have the median sulcus, and this is kind of a slight depression right in the middle of the tongue, and it runs from the tip of it to the base of the tongue. So you'll see that. So get a mirror, you're going to be, analyzing your tongue, and you'll be like, oh, okay, I see all that. Now we have the ventral surface of the tongue, and that's essentially the underside of it. Now we're going to talk about the teeth in the oral cavity. So the oral cavity is basically, it plays an integral role in the functions of the human body. Not only does it aid in chewing, digestion, nutrition, it also plays a significant role in appearance, speech, and sensation. So here we have teeth, and they're arranged in two arches that contain two quadrants, each which is 16 teeth in each arch. And so there's 8 teeth in each quadrant. So we have 8 here, 8 here, 8 here, 8 here. Total, there's 16 and 16 here. And this is basically in your permanent dentition, which is your adult teeth. You have your top arch, which is your maxillary arch, and this is fixed, it's fixed there. It doesn't move, essentially. And then we have your bottom arch, which is the mandibular arch, and this is capable of moving through the temporomandibular joint. So we call this a TMJ joint. Excuse me. So this is where you can kind of move your lower jaw forward, backwards, and we'll talk more about that as well. So now we have the divisions and components of teeth. So I'm just going to sip some water. And so in addition to having very specific functions for each tooth, they have a specific location which contains a specific shape that aids in its function. So we're going to go over that as well. So all teeth, though different shape and size, they have the same anatomical parts. So they have a clinical crown, so which is the top surface here, and that's the one that's exposed in your oral cavity. But then they have an anatomic crown, and that's from this CEJ, which we saw in the vocab, and that's basically the middle of your, where it kind of meets the gums, and its roots as well. So the teeth is attached to the underlying alveolar bone with fibers known as periodontal ligaments. So we'll go over that as well. So I want you guys to know that each tooth is made up of the same 4 components: enamel, dentin, cementum, and pulp. So what's enamel? So enamel is essentially a substance that covers the anatomic crown of the tooth. So right over here, this is the enamel. And it's the hardest substance in the body. And it's created by cells called the amyoblasts. And this is basically the first line of protection for the tooth. So when you have a cavity, basically your enamel is getting chipped, not basically decayed, right? And this can withstand biting pressure, but it does not have the ability to regrow once it's fully formed. So this can't regrow. It can't, once you have a cavity, it can't just regrow back. So that is basically when you do your fillings, essentially. So if there's a minor demineralization, which is basically when you're getting a cavity, it can remineralize, harden, and thus stop the tooth decay process with proper nutrition and oral care. So right over here, like I said, that is where you're going to be getting your cavities, and it's the strongest substance in the body. Now we have dentin, and so this is right over here. So it's underneath the enamel and the cementum in the tooth. So you'll see that right over here. It's kind of like the large part here. And it's created by cells known as the odontoblasts. And it's not as hard as the enamel, so it makes up the major portion of the tooth as well, like I said. And it's comprised of the microscopic tubes as known as dentinal tubules. So now we're going to go over primary dentition, secondary dentition, and tertiary dentition. So there's, again, 3 different types. Primary dentition is the most prominent form of dentition within the tooth. It's located between the enamel and the pulp chamber, and the outer layer of the dentin is which is closest to the enamel. So you see right here, this is the primary dentin. It is closest to the enamel right over here. So this layer of dentin is the most unique to the rest of the primary dentin. I keep saying that a lot, but I'm sorry. So then we have mantle dentin, which is formed by newly differentiated odontoblasts, which we talked about previously. And it forms a layer that is typically 15 to 20 micrometers wide. So it's basically right over here. So this is basically formed by new differentiated odontoblasts. Now we have our secondary dentition right here. So that is our, it's also known as adventitious dentin, and it's formed following the formation of the root. So right over here, it's basically formed when the root is formed. So it's typically after the tooth has erupted and it's fully functional. It grows at a much slower rate compared to the primary dentition, but it maintains its incremental aspect of growth. It has a similar structure to the primary dentin, but its decomposition is not consistent even around the pulp chamber. So right over here, it's not really consistent even around this area here, the pulp chamber. And then we have our tertiary dentin. So this is the one that is formed from a reaction to external stimulation. So this is basically, it's created when you have cavities, your teeth are, have a huge wear. And it's basically either reactionary or reparative. So what's the difference between the secondary dentin and the tertiary dentin? Well, the secondary dentin is a layer of dentin which is produced after the tooth roots are completely formed, but the tertiary is created in a response to a stimulus such as the presence of tooth decay or wear. I hope that makes sense. So now we're going to talk about the cementum. So this is the substance that covers the root of the tooth. So it's very thin and it's not as hard as the enamel. It has a similar hardness to bone, actually. So it's created by the cementoblasts. So you're going to see a lot of blast root words here. So cementoblast, odontoblasts. What was the other one? And there are forms that project from the cementum and attach it to the alveolar bone. So right over here, you're going to see that. And so it could be abraded by such things like bristles of a stiff toothbrush. So you guys got to be careful when you're brushing your teeth. You have hard bristles and you have soft bristles. I highly recommend getting soft bristles. That way you're not kind of ruining the cementum as well. And if it becomes exposed to the oral cavity through, if you have gum recession here, it can become very sensitive to temperature changes in the mouth. So if you feel like you have sensitivity, it's probably because your cementum is exposed now. So when you have gum recession here, that's going to be the one that you're going to see at the bottom right over where the gum receded. So the enamel and the cementum meet at an right over here, which is the, what is it called? The CEJ, or the cemental enamel junction. So right over here, you're going to see that. So now we're going to talk about the pulp. So the pulp is the final component where all the nerves and the blood vessels that supply the tooth are housed. So right over here, you're going to see the pulp, and it's divided into 2 areas. So you have the pulp chamber, which is located in the crown of the tooth, so right over here. And then you have the pulp canals, which are located in the roots of the teeth. So right over here. So this is where the root canals are taking place. So it's where you're gonna see the doctor use a file, and he's basically taking out the nerve from this pulp root. Now, if this becomes exposed to decay, a bacterial infection can occur, and that's again where you're going to be getting a root canal to save the tooth. So when teeth first erupt, the pulp chambers right over here and the canals are very large. But when you have the second dentition and that forms, it basically decreases. So again, when you first have teeth erupt, these are very large. So if you have like a younger sister or brother and you see their x-ray, you're going to see they have really large pulp chambers and pulp roots as well. Pulp canals, sorry. So now we're going to be talking about teeth and their function. So this is basically what you guys are all looking for. So the incisors are the four front teeth at both the upper and the lower jaws. So their function is to cut food, and the two incisors on either side of the midline, so your two front teeth, those are called your central incisors. And so the ones adjacent to those teeth are known as your lateral incisors. So I myself, when I was a kid, I chipped my central incisors. So that's how I learned that. And they have only one single root here. Do you see that right there? That's a single root, but they have a sharp incisal edge. So what was incisal? It was the top right over here, kind of like the biting surface of your tooth. That's what we call incisal. Now for canines. So the canines, there are four canines in the oral cavity. There's two in the maxillary arch and two in the mandibular arch. So they're behind and adjacent to your lateral incisors. So right after your lateral incisors, you're gonna have your canines. And their function is to tear food. They have a single point right over here. I'm gonna show you a 3D version after. And they have a single root as well, similar to your incisors. But the most interesting thing about the canines is that they have the longest root of any other tooth. And they serve basically to form the corners of the mouth. So we're going to see here, we have two different 3D models. So we have your canines here, and we have our incisors here. So canines, you have your maxillary and your mandibular canine. And for your incisors, you have your central incisor for both mandibular and canine. And you can also see the lateral incisors right over there. Okay. So now we're going to talk about the premolars, which are also kind of known as the bicuspids. So these are located adjacent to the canines, and they're designed to crush food. And you have 8 of these premolars in your oral cavity. So you have, there's 2 in each quadrant. So 2 on your left side, 2 on your right side, and same goes on the bottom and the top. And the one closest to your midline, so the first one that you see, that's the one called the first premolar. And the one farthest from the midline, that's the second premolar. So these teeth have 2 to 3 different cusps. So that's the essential grooves. Not grooves essentially. They're more of like the tips, I want to say. Or yeah, I'll show you all of that after. The maxillary first premolar has 2 roots, which is really interesting. But the remaining premolars have a single root. So there's no premolars in your primary dentition. So when you're a child, you're not going to have your premolars. That's when you're becoming an adult. And same with your molars. So these are the most posterior teeth in the mouth. And these are the ones that, again, the ones at the very back, your wisdom teeth, you're going to have 3 of these molars. So they have a broader and flatter surface, like you see here. And they have 4 to 5 different cusps. So 1, 2, 3, 4. So you'll see that. And they're designed to grind the food. So the mandibular molar, which is your lower molars on your jaw, that has 2 roots. But the ones at the top, they have 3 roots, which is really interesting. So there's 12 molars. So you're going to have 3 on each quadrant. So 3 on your left, 3 on your right, and same goes to the bottom. However, some people don't even have their wisdom teeth, which is really interesting. I know some patients that I've had they never had their wisdom teeth. And some maybe have 3, some just don't have them at all. And so they are, they're named starting with the closest to the midline. So the first one you see is the first molar, then it's your second, and then it's your third. So like I said, they don't really fully develop. Some people don't develop their third molars, which is, again, your wisdom teeth. And it's only in the primary dentition, they only contain 8 molars. Okay. So again, we're going to talk about the surface of the teeth. So this is when you're identifying teeth and referring to specific areas. It's necessary to utilize the surface names and the directions designated according to where it is located. So teeth have a number and a letter like designations. So there's several different types of that in identification systems. The most common one is the universal system, and we'll go over that after. But again, the one thing I tell my students that come to the shadowing sessions is to know the different surfaces. So distal is away from your teeth, facials, the one that's facing your cheek, labial towards the lips, buccal is towards the cheeks, incisal, the biting edge of the anterior teeth. So again, incisal is for your the teeth in the front. You have lingual, which faces the tongue, mesial, which is closest to the midline, occlusal, which is your chewing surfaces for your posterior teeth, so the ones in the back. And you have proximal. So these are 2 surfaces that are next to each other, which is distal of lateral incisor and mesial of canine, so stuff like that. Okay, so now we're going to talk about your primary dentition. So again, this is when you're a baby, you're only a few months, and basically a child. So these are the first to erupt into the oral cavity. The primary dentition is composed of 20 teeth. So adult teeth, they have 32. Primary, you have 20. So often, and again, these are referred to deciduous teeth. And so these will be lost as the permanent teeth will be erupting. So in each of these arch of the mouth, there's 2 central incisors, 2 lateral incisors, 2 canines right here, and you have 4 molars. So you have 2 here and 2 here. And these teeth are usually recognized by a letter of the alphabet, and it starts with A here for your maxillary right second molar, and it ends with T. So this is your mandibular right second molar. So again, like I said, the wisdom teeth is not in the primary dentition. There's no premolars and no third molars, just like I said. And so the approximate eruption is 6 to 7 years old. Same with your lateral incisors. So once you see a baby grow, you're going to see they're growing their teeth around 8 months, 9 months, and they're just continuing to grow and losing your teeth as well. Next is your permanent dentition, which is your adult teeth. So this again is your 32 teeth. You have 16 in your maxilla and 16 in your mandible. Each arc has, again, 2 central incisors, 2 lateral, 2 canines, 4 premolars, so you have 2 here, and 6 molars here. So 3 here, and same with over here. The permanent central incisors and the lateral canines, first, second molars, these ones replace the primary dentition, like I said. The primary molars are replaced with the permanent premolars, and the permanent molars erupt posterior to those. So here we have, I'm not sure if you can see it, but we have kind of the eruption date as well here. So your third molar essentially is when you are 17 to 21 years old. Some people, again, I've known people, they're in their 40s and they've never had a wisdom tooth erupt, which is really interesting. Oh my, I'm not really. Can you guys hear me okay? So now we're going to talk about occlusion. So this is something that I really am interested in. This is the part where occlusion is defined as the way the teeth meet the lower jaw. So the mandibular and the upper jaw here come together. So it's how teeth contact in any type of functional relationship. So normal occlusion is desirable. So it's allowing the teeth, the oral functions to operate properly, provide the best type of aesthetics that you'll see here. And it's really helpful in the prevention of disease. So anytime there's like normal occlusion does not occur, so you don't have a normal bite like this, it's termed as malocclusion. So this can have effect on dental diseases, chewing, speech, and obviously aesthetics as well, especially when you're in your facial profile. You can definitely see a huge difference here, especially with like an underbite. And that can occur for like many different reasons. But it can include, but it's not limited to like your genetics, if you've had trauma, any diseases, and habits. So when you are a kid, I highly recommend, if you know someone that has like a child, tell them to not let them suck their thumb for so long. Because I know someone, they've been sucking and pulling on like a blanket when they were a child, that their entire upper jaw is just moved forward. And it's really sad because now they're like in their teens and they're not really happy with their smile. And so they have to go through surgery for that. So definitely tell anybody that you know to not allow their children to do any thumb sucking or any type of biting of some sorts. That could kind of move your teeth and jaw forward. So occlusion is designed according to certain classifications. So I'm going to show you 3 different types, and it shows the relationships of the teeth and the variations of malocclusion classifications. So this is based on how the maxillary and the mandibular first molars come into contact. So right over here, remember our first molars? We have to basically see how that's coming into contact with one another when we close our teeth and our mouth. So the common system used to classify this is termed Engel's classification system. So you're going to see here, there's class 1, which is your normal type of bite that you want to have. But then you have class 2, which is considered an overbite. And you have class 3, which is a underbite. So I'm going to show you guys an animation or a GIF you'll see here. So do you guys see that? So class 3 is an underbite. So that's where your first molars are completely not aligned. And same with our second class. So this is distal occlusion. So you'll see that right here. Yes, exactly. Pre-ortho trainers for kids, and that basically trains the lips and jaws to prevent the need for braces. Yes, exactly. So we're almost there, guys. So in order to understand how diseases, processes can affect the oral cavity, it's really important to kind of know the structure of the periodontium. So this basically includes the gingival tissue, so like your gums, and the supporting bone. So the gingiva usually exhibits one of the first signs of inflammation through redness, bleeding, or swelling. So you're going to see that. So if you're brushing too hard or there's an infection in your tooth, you're going to see inflammation, bleeding, and swelling. But although it's not necessarily a sign of periodontal involvement, it's imperative to kind of understand the underlying structures and how they interact. So it's really important to kind of know what your teeth, what your gums are really doing. So normal gingiva is, different in color. You can have light coral pink to really pigmented gingiva. And it's usually in a stipulated appearance. So it's kind of like, if you look at an orange peel, it's similar to that kind of resemblance. The makeup of the gingival tissues, it really varies according to the location and the function. And there's 2 different types of gingiva, and it's really important to kind of know the anatomic regions. So we're going to go over here. So we have the alveolar mucosa, So this is the area of tissue beyond the microgingival junction. So it's really seems less firmly attached and redder than attached gingiva, and it's non-characterized and it provides a more softer and flexible area of movement of the cheeks and the lips. So that's right over here, right at the bottom, essentially. Now you have your attached gingiva. So that's here. So this is essentially what is adjacent to the free gingiva, and it's keratinized and firmly attached to the bone structure. So that is right over here, right at the bottom of your tooth. You'll see that there. Yeah, right over there. I'm trying to look. And it can range from 3 to 12 millimeters in height. So I'm going to talk about kind of what happens when you go to a new patient exam, and you'll see that at our shadowing event. You're going to hear the doctor say different types of millimeters, and I'll go over that as well. So free gingiva, right over here, is the tissue that's not attached. So this kind of forms a collar around the tooth. So this is where the doctor will put a probe in to see how healthy your teeth are. So your gums are, sorry. So when it's around 2 to 3, it's a good range. But when it goes to 4, 5, 6, that's when it's like, uh-oh, you got to really take care of your gums because it's not healthy. It's not good to have a probe go that deep. That means it's a really deep pocket. There's a big space between your gums and your tooth, which is not really good. And so we have our gingival margin, so right over here. So this is the border region where the tooth touches the gingiva, where it touches the gums, essentially. You have the interdental papillae, which is the gingival tissue that fills the space between the adjacent teeth. So in a healthy mouth, they have a knifed edge and they're filled with interdentin space. And lastly, we have the mucogingival junction. So that's all the way down here. So this is the scalloped line that divides the attached gingiva from the alveolar gingiva. Sorry, the alveolar mucosa. So right over here, you'll see that when you kind of lift your lip, you're going to see that curved or that line. That's what is called the mucogingival junction. Okay, so now we're going to talk about dental numbering systems. So this is also really important. I'm going to go over 3 of the most, well, those are basically the 3 different numbering systems. So first one we have here is the universal numbering system. So here we start with tooth number 1, which is the farthest back on the right side of the mouth on the upper jaw, so your maxillary jaw. And it's going to continue all the way to number 16, which is the opposite side, and that's your back tooth right over here on your left side. And it's going to drop when you get to your lower left of your jaw. It's going to go from 17, and it's going to go all the way to your 32. So also just keep note, if you're missing teeth, like your third molars, so your wisdom teeth, your first number will be 2, not 1. Does that make sense? So you're kind of acknowledging that you have a missing tooth, if that makes sense. So if you don't have your wisdom teeth here, you're not going to start as 1 on your second molar. You're going to have this as 1 and then 2 because you're just showing that you don't have that tooth. The second one is the Polymer notation numbering system. So originally, this is used by orthodontists, pedodontists, which are the pediatric dentists and oral surgeons. So originally, it was called the Zsigmondy system after an Austrian dentist of that name who developed the idea in 1861. So you'll see here that the mouth is divided into 4 sections. So again, these are called the quadrants. So number 1 through 8, and it's basically a universal symbol that's used to identify the teeth in each quadrant. So you'll see here, there's kind of like an L shaped. So the upper right quadrant with tooth number 1, this number continues to the back of the teeth till tooth number 8, which is going to be your third molar. And so it sits beside, you see again, the L here. It's basically the, when you see the L on the right side up for the teeth, that means it's the the upper left quadrant. And the teeth in the bottom, it's going to be upside down right over here. So you'll see that. So there's going to be letters like UR, UQ, URQ, stuff like that. And that's basically for the upper right quadrant. So that's basically how you're going to identify these types of the numbering system. Then this is my favorite type of numbering system. This is essentially a worldwide 2-digit system. So every branch of dentistry uses this. Each quadrant is assigned a number. So here, your right side's 1, your left side's 2, bottom left is 3, and bottom right is 4. So when you're looking in the mirror, look at it. So 1, 2, 3, 4 is how you get the numbers. So here, the maxillary right quadrant, right here, this is 1, same thing, 2. And you're going to basically have the 1, 1 to 1, 8. So the 1 here represents quadrant 1, 2 is the quadrant 2, and so on and so forth. So that's basically what you'll hear mostly in the dental office that you see. I know we use this in my dental office. We say, okay, 4, 5 MOB. So that's the surface when we talk about kind of like the cavities or the previous kind of restorations or fillings. And so guys, I think that is all for today. I'm surprised I went really fast, but again, this is the overview of dental anatomy. I do have a textbook. Let me go back on here. I'll see here. Okay, there you go. So I do have a textbook here that I can go through all of the different chapters. It's really interesting. It's stuff that I use as well. So let me know if you want to do that. Again, if you really want to be a presenter, I highly recommend you doing so. It's a really beneficial way of gaining more experience and more research skills as well. And so that is all for today. Thank you guys so much for joining for our first presentation. I really hope this was well and you learned a lot. Again, please let me know if you want to learn more. I also want to recommend you guys, if you haven't already, to subscribe to this YouTube channel, because this is where we're going to have our presentations on here, or whether it's going to be on Zoom, whatever is recorded, we'll post on here as unlisted. So if you're a part of the study club, you will get the links for these. So make sure you're part of that. Join the WhatsApp group and follow our new Instagram page. That is where you're going to get more updates as well. And if you want to contact us, again, the WhatsApp group, the email address is Predental Study Club, and our Instagram page is Predental YU or the Predental Study Club.